Pregnancy is a complex biological process in which the female reproductive system undergoes continuous changes over time. Understanding whether sexual activity is safe during pregnancy requires looking at how the body protects and supports the developing fetus. The process begins when a fertilized egg implants into the lining of the uterus. As it develops into an embryo, the body forms protective structures, including the placenta and amniotic sac. These structures play a crucial role in shielding the fetus from external pressure and maintaining a stable internal environment. During early pregnancy, also known as the first trimester, the embryo is small and securely placed within the uterus. The cervix remains tightly closed and is protected by a mucus plug, which prevents infections from entering. At this stage, in a healthy pregnancy, the uterus is well protected internally. As pregnancy progresses into the second trimester, the fetus grows and the uterus expands. The amniotic fluid surrounding the fetus acts as a cushion, absorbing physical pressure and protecting the developing baby. At the same time, hormonal levels, especially progesterone and estrogen, increase to support the pregnancy and maintain stability. Blood flow in the pelvic region also increases during this period. This is a natural adaptation of the body to support the growing fetus. The reproductive organs remain protected, and in normal conditions, the internal structures are designed to handle external movements safely. In the third trimester, the fetus becomes much larger, and the uterus occupies more space in the abdomen. Pressure on surrounding organs increases, and the cervix gradually begins to soften as the body prepares for delivery. Although the protective systems are still active, the body becomes more sensitive during this stage. In most healthy pregnancies, sexual activity can be safe because the fetus is protected by the uterus, amniotic sac, and cervical barrier. However, there are certain conditions where it may not be recommended. These include cases where the placenta is positioned abnormally, known as placenta previa, or when there is a risk of premature labor or other complications. The decision depends on the condition of the pregnancy. The body has strong natural protective mechanisms, but medical guidance is important in high-risk situations. Understanding how the uterus, cervix, and protective layers function helps explain why safety can vary from one case to another.